diabetes people can lead a very normal life. Let us know about this diabetes and how the lifestyle changes can change the diabetes people to lead a normal life. We'll see in this video. What exactly? Om Namo Venkateshaya. I'm back after 2 weeks. I was writing this Indira Gandhi University Diet and Nutrition exam. So I wrote the exam, waiting for its results. Into a lot of diabetes mellitus cases. This is normally called sugar in our routine life. With a little bit of diet modification, diabetes people can lead a very normal life. What exactly will happen in this diabetes mellitus is that the insulin level, which has to be secreted from the pancreas, the insulin levels are either secreted low or it is secreted nil, or even if it is secreted normal, it is of no use to the cells. Actually, what is the function of this insulin? Insulin is actually going to make the glucose, that is whatever the carbohydrates we eat, energy giving foods we eat, it is converted into the smallest particle, that is glucose. This glucose is further entered into the cell. Each cell, that is smallest unit of any body, is a cell. So this glucose has to enter into the cell, so that the function of the cell will happen with the help of this glucose. But when there is no insulin or insufficient insulin, this amount of glucose entering into the cell, that is the function of the insulin, is lost. So a lot of glucose is available in the blood but not in the tissue, not in the cells. What happens? Invariably, glucose levels in the blood increases and the tissue or the cell cannot function properly. So this is the condition called diabetes mellitus. There are two types of diabetes mellitus, that is non-insulin dependent diabetes mellitus and insulin dependent. Those people who have completely nil insulin in their body is called insulin dependent diabetes mellitus. They have to take insulin compulsory. Non-insulin diabetes mellitus, in those people there is a little bit of production of this insulin in their body, still functions. So in them we can give diet modifications. Along with that, oral hypoglycemic drugs, that is the tablet formations, can be given in those people. So what exactly is going to happen here? Because the glucose is not utilized by the cells, the glucose is a lot of glucose is there in the blood. This glucose will enter into the urine, that is the kidneys, and excess glucose in the kidneys is going to excrete from the body. So a lot of urine will go in these people. So that's why this polyuria feature will be there. And if the polyuria feature is there, that is excessive urine is passed, lot of thirst will be there, that is polydipsia. So excessive intake of the fluids has to be taken. If excessive intake of fluids is not there, then definitely they will go in for dehydration. So that is sunken eyes and all those symptoms will be there. And if this excess glucose is there in the body but it is not utilized, so then how the cells will get the energy? Here the point is that cells gets the energy through the secondary source of energy and tertiary source of energy, that is fats and protein metabolism. So the fats initially gets metabolized and produces glucose to the gives energy to the cell. This is how the fat metabolism happen. And then the protein, if fat is not taking over, then the protein gets a breakdown of the muscle, and that leads to giving up of the energy to the cells. So what happens? There is a weakness, general weakness of the body, because the proteins and the fat has been metabolized from the body, and so weakness will be there in the body. And wherever there is a wound or a surgical sites, the healing power of that will be reduced in those. And in fact, the presence of glucose in the blood also acts as a source for the microorganisms to grow up in the body. These things will be there. And excess amount of the fat metabolism, the fat is excreted through the urine, and ketosis, that's a symptom where the patients go into, the people with the diabetes, when they go into ketosis, they go into coma, that is the excessive glucose levels in the body. So these are the symptoms. Along with that, they will be having peripheral neuritis like pin and needle sensations in the legs, cornea problem, retina problem, heart problem, atherosclerosis problem. So many problems will be there, brain strokes. So all these things will be happening in those people with excessive or prolonged diabetes mellitus with the uncontrolled dietary modifications. So in our subsequent videos, we will discuss a lot of things about diabetes mellitus, what are the identifying, how it is being identified, and some more upon the dietary modifications, insulin, non-insulin. So all these parts will be discussed in our further videos. If you have any queries on this diabetes, you just write a comment in the comment box, so that in our subsequent episodes, diabetes series episodes, we are going to discuss on these topics. Thank you so much and have a very great day, my dear friends.